You're right, American healthcare is world class. It has some of the best doctors, hospitals, drugs, medical devices, and research institutions in the world. But for the American middle class, accessing that excellence has become a heavy financial decision. That financial pressure is exactly why more families are looking overseas for a surprising alternative, China. In 2024, the United States spent $5.3 trillion on healthcare, about 18% of the entire US economy. To make that number real, US military spending in 2024 was about $997 billion. That means America spent more than 5 times as much on healthcare as it spent on its military. And this is not only a national budget story, it reaches the family kitchen table. In 2025, the average annual premium for employer-sponsored family health insurance was almost $27,000. Workers paid about $6,850 of that out of their own paychecks. And after paying premiums, many people still face deductibles, co-pays, co-insurance, prior authorization, in-network rules, out-of-network risk, and the final bill that may arrive weeks later. A former colleague in the US once told me something I never forget. I have insurance, but I still don't know if I can afford to get sick. That sentence explains the real anxiety. The American middle class is not afraid of doctors. They're afraid of entering a system where the bill, the approval, and the final cost may come after the medical decision. This is important. The problem is not always that Americans have no insurance. Many middle-class Americans do have insurance. They have employer-sponsored plans. Many have PPO plans, which are more flexible than HMO plans. With a PPO, you may not always need a formal referral to see a specialist, but flexibility does not remove uncertainty. A PPO may give you more freedom, but you still have to ask, is this doctor in network? Is this hospital in network? Is this imaging center in network? Will insurance approve the MRI? Will the anesthesiologist be covered? How much this will hit my deductible? Will I receive a bill 3 weeks later that I did not expect? That is why this video mainly focuses on middle-class Americans with employer insurance, especially PPO or high deductible plans. Because this group is not poor enough to receive full public assistance and not rich enough to ignore the bill. They're exactly the people who have to do the math. Health policy people have a simple model for this. It is called the healthcare iron triangle. Cost, quality, access. Every healthcare system is trying to balance these 3 things. If you push for the highest quality, cost often rises. If you push for low cost, access or comfort may suffer. If you push for broad access, the system may become crowded or financially strained. The United States is extremely strong on the quality side. It has elite hospitals, advanced drugs, complex surgeries, cancer centers, and world-leading medical research. The problem is not the absence of the excellence. The problem is the cost of accessing excellence. Now, let's look at what actually happens to a middle-class patient. Let's say someone has stomach pain, dizziness, or unexplained fatigue. In theory, they have insurance. But in practice, the path can look like this. First, they may book a primary care visit. Then they may need a specialist. Even with a PPO, they still need to find someone available, in-network, and affordable. The specialist may order imaging or lab tests, but the imaging center may be separate. The lab may be separate. The hospital may be separate. The doctor's billing group may be separate. And before some expensive tests, the insurance company may require prior authorization. That means the doctor may think you need the test, but the insurance company still has to approve it. Then, after the visit, you may receive an EOB, explanation of the benefits. But the EOB is not always the final bill. It is an explanation of what was billed, what the insurance company allowed, what they paid, and what you may still owe. So for the patient, healthcare does not feel like one system. It feels like a maze of networks, approvals, codes, and bills. And this is why medical bills feel different from other bills. A car repair is expensive, but you can ask for a quote. A vacation is expensive, but you choose the package before you go. But in healthcare, you may not know the real cost until after the service. That is why medical debt remains such a powerful fear in the US. A widely cited study linked medical problems to about 2/3 of the personal bankruptcies. That number is debated because bankruptcy usually has more than one cause, but the anxiety is real. A more conservative and widely accepted way to look at this is medical debt. KFF estimates that people in the United States owe at least $220 billion in medical debt. About 14 million adults owe more than $1,000. About 3 million adults owe more than $10,000. So when an American middle-class family hesitates before seeing a doctor, it is not irrational. They're doing risk management. So when some Americans start looking at China for healthcare, it is not because they suddenly believe China has magic medicine. It is not because China is perfect, and it is not because every Chinese hospital is better than every American hospital. That is a wrong question. They're not comparing countries, they're comparing pathways. They're asking, is there another way to get answers faster? Is there another way to understand the cause earlier? Is there another way to complete more steps in one trip? Is there another system that can turn uncertainty into a plan? This is where China becomes interesting. Not as a miracle, but as a different system design. China's healthcare system is not perfect. Large hospitals can be crowded. Doctors may have shorter consultation time. There are regional differences. For foreigners, language and process can be difficult, but in selected, planned, non-emergency medical services, China may create a different balance point inside the healthcare iron triangle. Why? 3 reasons: scale, concentration, cost structure. First, scale. China's healthcare system handled 10.15 billion patient visits in 2024. That number is hard to visualize, so compare the structure. The United States has some of the most advanced hospitals in the world, but it has about 2.8 hospital beds per 1,000 people. China has about 7.32 medical institution beds per 1,000 people. The US has about 2.7 practicing doctors per 1,000 people. China reports 3.61 licensed and assistant physicians per 1,000 people. These categories are not perfectly comparable, but the direction is clear. China is not low-frequency medicine. It is high-volume medicine. Scale does not automatically create better medicine, but scale does create clinical exposure. In China, the system reported 10.15 billion patient visits in 2024. It also reported 5.08 million licensed and assistant physicians. Chinese physicians handled about 9.7 patient visits per doctor per day on average. That does not mean every doctor is better. It does not mean every visit is ideal, and it does not mean the patient experience is always comfortable. In fact, the downside is obvious: crowded hospital, short consultation time, and the pressure on medical staff. But for high-frequency semi-standardized services, physical exams, ultrasound, CT, endoscopy, dental work, routine specialty consultations, volume creates repetition. Repetition creates workflow. Workflow creates speed. That is what I mean by clinical experience density. High patient volume does not guarantee quality, but it can create clinical exposure that lower frequency systems may not generate in the same way. The second reason is concentration. In the US, the patient journey is often fragmented. Even with a PPO, a patient may move from primary care to specialist to imaging center to lab to insurance approval to EOB and finally to the bill. Each step can be medically reasonable, but from the patient's point of view, the journey is fragmented. In China, for selected planned services, the path can be more concentrated. A hospital or health management center may place physical exam, blood tests, ultrasound, CT, endoscopy, report printing, and doctor review inside one coordinated environment. This does not mean every patient can finish everything in one day. That would be an exaggeration. But with the right city, the right hospital, the right project, and advanced coordination, several medical steps can often be compressed into a few days. That is very different from the American experience. Let me give you a concrete example: preventive checkups. For many Americans, an annual physical is often basic. If they want an executive physical, advanced imaging, tumor markers, ultrasound, specialist review, and a full report, the price can quickly become unclear or expensive. In China, many large hospitals and health management centers package preventive exams in a way that looks more like an itinerary. You can see the departments, you can see the lab panels, you can see imaging, you can see the price before you start. For example, in the physical exam package we're looking at here, the checklist includes clinical examination, blood and biochemical tests, tumor markers, thyroid testing, inflammatory markers, immune markers, ECG, ultrasound, chest CT, bone density, eye examination, vascular assessment, psychological screening, and final report review. The important point is not simply that it is cheaper. The important point is visibility. For an American patient, this is often the shock. The medical package is visible before the visit. The third reason is cost structure. China is not cheaper in some areas because medicine is simple. Medicine is not simple anywhere. The difference is cost architecture. In the United States, healthcare prices are shaped through negotiations among hospitals, insurers, employer plans, networks, billing codes, and provider groups. A hospital has list prices, insurers negotiate rates, employers choose plans, patients face deductibles and co-insurance. And the final bill may only become clear later. In China, many services are shaped more directly by public hospital pricing, policy-guided prices, insurance payment rules, centralized procurement, lower medical labor cost structure, and very high utilization. China is not a classic single-payer system in the American policy sense, but compared with the US commercial insurance market, China has stronger public payer purchasing power, government-guided pricing, and centralized procurement. That changes the cost structure. It lowers prices in some areas, but it also creates trade-offs. Crowded hospitals, shorter doctor time, pressure on medical staff, and uneven service experience. So again, China is not perfect. It simply creates a different balance point. Now we have to be very clear. This is not for every patient. This is not for emergency medicine. This is not for people who need immediate life-saving care. This is not a promise that China is better for every disease. The best use case is planned medicine. That means medical needs that can be scheduled, evaluated, documented, and coordinated in advance. For example, physical checkups, dental care, imaging like MRI, CT, and ultrasound, endoscopy, colonoscopy, eye exams, rehabilitation assessment, chronic condition second opinions, specialist consultation for non-emergency problems. This is where China's system can become interesting for some Americans, not because it guarantees better care, but because it may make the process faster, more visible, and more plannable. But here's the real problem. The hard part is not just flying to China. The hard part is knowing which city, which hospital, which department, which doctor, which tests, which documents, which translation, which risks, and which cases should not come to China at all. This is where a medical travel navigation service becomes valuable. We're not replacing doctors. We do not diagnose. We do not promise treatment outcomes. We do not tell patients to ignore their local physicians. Our role is different. We translate the system, not just the language, the system. We help patients understand whether China is appropriate for their case. We help them prepare medical records, choose hospitals and departments, book checkups or specialist visits, estimate budgets, coordinate appointments, accompany them through the hospital, translate reports and doctor instructions, and organize the documents so they can continue follow-up care with their local doctor when they return home. For cost-anxious patients, we help make the budget more visible. For access-anxious patients, we help coordinate the path faster. For navigation-anxious patients, we translate a forming medical system into a usable itinerary. So why are some middle-class Americans starting to look at China for healthcare? Not because China is perfect, not because China is always cheaper, not because Chinese hospitals are automatically better than American hospitals. The real reason is more practical. American middle-class families are no longer only asking, where is the best doctor? They're asking, where can I get answers faster? Where can I understand the cost earlier? Where can I complete more steps in one trip? Where can I reduce uncertainty? That is the real opportunity. China does not escape the healthcare iron triangle, but in selected, planned, non-emergency medical services, China may create a different balance between cost, quality, and access. For the right patient, the right condition, and the right hospital, China may not be a miracle. It may simply be a more plannable pathway. And for many middle-class families, that may be enough to make them look again.